Are you looking for somebody to give love to this Valentine's Day? Fidelity should be right at the top of your list.
Yes, absolutely. We are Shannon and Michael. We're with Healthcare Genius, and we want to give a shout out to Fidelity because they are one of the only ones out there that are really talking about healthcare costs in retirement. It's an increasingly important issue to consumers, yet for whatever reason, people aren't talking about it. So although we give them props and we want to give them love for Valentine's Day, we don't 100% agree with some of their findings. So can you just kind of give us an outline of the study that we're referencing here, why we're giving them the shout out, and what they've kind of come up with in terms of average healthcare retirement costs?
Yeah, Shannon. So Fidelity for at least 10 years that I know of has come out with a projection on healthcare costs. And it is an average in their defense. Mm-hmm. So this in 2019, that number was $285,000 for a 65-year-old couple. If you were single and a male, the number was $135,000. If you're single and a female, it's $150,000.
So does that mean they think that's what you'll pay from the time you retire till the time that you pass?
That's correct. Yep. And they use averages, which again, when you're doing this types of calculations, you have to use an average. So I think their mortality projection for a male is 85 and for a female is 87. But what Fidelity doesn't calculate in their numbers are the higher costs for Medicare means testing of Part B and Part D.
Right. So a lot of times people think that once they retire and they take Medicare, it'll be affordable and that everybody pays the same amount for Medicare. And if that were the case, these projections would be a lot simpler. We think what's happened is that Fidelity hasn't really, like Michael said, taken that means testing factor into account. And what the means testing means, we actually also call it the punch in the gut tax from Social Security. It means the more money you make in retirement, the more you pay for Parts B and D Medicare.
And that can actually take and increase a couple or a single person's cost by 2 or 3 times the amount.
Yeah, even we have seen in this last year 4 times the amount that somebody that's in the lowest bracket will pay versus the highest bracket for the same coverage.
And why that's so important when it comes to Part B as we look at it, I mean, the inflation rate on Part B has been over 7%. So if you're taking that 65-year-old couple and let's say they do make it to 85, that essentially means that whatever the premium is today, it'll be 4 times as much at age 85.
Mm-hmm. Pretty scary, huh? So that's why we're glad Fidelity's talking about it, but that's kind of the one piece that we think could be fine-tuned, and that's one of the things that we do in the report that we've created that will calculate healthcare costs in retirement. If you want to take a look at that, we have a link in our description below where you can take a quick quiz, input some of your information, and see what your healthcare costs in retirement will likely look like. And it does take that means testing into account. And the second piece we want to talk about is the real hole in Medicare, but that we consider in the realm of healthcare costs in retirement, and that is long-term care.
Yeah, long-term care is something that Medicare, a lot of people are under the misunderstanding that Medicare covers long-term care, and while it will cover some specific days and things for Medicare, it will not cover a nursing home stay for most people, nor will it cover in-home care, which can be extremely expensive. You know, I think Shannon, some of our other videos pointed out $100,000 on average throughout the United States. So this is a huge hole. Our report will give you an idea of what those costs look like. But the problem with long-term care costs is it can destroy the best financial plan.
Absolutely. You're right, Michael. It can destroy the absolute best financial plan. And the last thing that we want to see is people do such a great job of planning for retirement and managing their assets, and then one event can knock all of that out. So make sure that's something that you're thinking about during the planning process. We know that there are some great financial advisors out there, but there is a big misunderstanding surrounding Medicare and long-term care. So if you want more information on either of those topics, we've got a ton of videos that really dig in and dive deep on the details with both of those things. If you're looking for some help, we encourage you to either talk to your advisor, or if you don't have someone you can turn to, we're the absolute experts on this topic. We specialize in healthcare and retirement, and we're always here to help.
And happy Valentine's Day, Fidelity.
Yes, happy Valentine's Day. Subscribe to our channel and make sure you click the notification bell so you know when we come out with new content. And if you liked this video, feel free to give us a like or let us know in the comments. Thanks.